Welcome back to the Healthy Chicago podcast, where local health professionals and their guests discuss the latest public health issues affecting Chicagoans.
Hi, I'm Jonathan Hart, owner and design director at Bigmouth Creative. I'm here with Dr. Simbo Ige, Commissioner for the Chicago Department of Public Health. We're here today to talk about mental health, and I'm so excited to be talking about that. That is something that is so important to our team, both internally and the work we do with some of our own external partners and clients. So the first question I have for you is, there's so much going on in the world right now, so much for folks to be anxious about, to be thinking about. What can you say to them to really help them preserve their own mental health, to help them feel empowered to take action for their own mental well-being?
Well, thank you, Jonathan. And my conversation today, I want to center it around health, and that is how you preserve the state of wellness more than illness. There is so much happening, and sometimes things don't go the way we plan. And the world can be really unpredictable. So the question is, when these things happen that are outside of your control, things are not going the way you had hoped, and things feel overwhelming. First, I just want people to know that it is okay to feel overwhelmed, that there are times when there's a lot going on. So the first thing is for people to acknowledge that there is a lot going on, and it's okay to feel exhausted and tired and frustrated and angry. Now, how do we process these emotions is the next step. It is important that when you're feeling overwhelmed, you understand that, we like to say upstairs brain and downstairs brain, that decisions made when you're really frustrated or angry or overwhelmed are often not the decisions you would like to make when you're not in that state. So just giving yourself a little space, it is always a good idea to, I say to my children, count to 10. I can see the frustration, I can see that you're angry, I can see that you're overwhelmed, but just taking a moment to breathe and pause just gives us an opportunity to bring down our heart rate, bring down the stress hormones, and then start to process, what do I do next? So we want folks to know that there are ways to process what is going on and then start seeking help. Now, the easiest way to get help is having a community of support. Friends, family, people who can help you when you're feeling overwhelmed. Just listening, just being there for you, just reassuring you that, some things happened in the past and you got through it. You can do this, we're here for you. And for some people, they don't readily have friends and family that can be supportive or non-judgmental or who can acknowledge their feelings. And if that is the case with you, we want you to be able to reach out to professionals who can listen and support you. We also want folks to know that there are even other home remedies that can help you feel better when you're feeling overwhelmed. Making sure you're sleeping well, getting adequate sleep. There are certain foods that just help boost your good hormones, bananas, other kinds of fruits. Sometimes people feel like, I think I need a drink, I want to use alcohol, I don't want to feel this pain, I don't want to feel this frustration. Oftentimes that's just a very temporary relief, and then the subsequent feelings are even worse than before. So we don't want to encourage people to lean on substances or alcohol to deal with bad feelings, but exercise and fruits and good company and doing things that you enjoy. 30 minutes of exercise is as effective in boosting your mood as antidepressants. So take a walk outside, talk to a friend, eat some good food, dance, watch a comedy. These are things that we can do, again, to restore ourselves to that state of balance. But we want folks to know that sometimes, life can be overwhelming, and it's okay to acknowledge that and then start to take some steps to restore yourself back to, the state of equilibrium.
According to 2023 data of hospital admissions, severe mental illness is one of the top causes of hospitalization here in Chicago. What can you say to caregivers to help those that they care about, their friends, their family?
Yes, I started my conversation with just how to handle stress and handle life when things become overwhelming. But there are times when there is actual mental illness that has progressed. So there are severe mental illnesses like psychosis or major depression or bipolar disorder that requires treatment and long-term support. We know that many people who have severe mental illness also require long-term support from friends and family. And so we want folks to be able to understand that severe mental illness requires ongoing support, and for caregivers also to know that it is okay for them also to feel support, to need support, and that there are resources to help them cope with having to see family and loved ones, wrestle with severe mental illness. Encouraging people to use their medication is always very important. Staying connected to therapy and other kinds of support is always very important. But even as caregivers, you also may need that support and therapy to help you deal with the requirements of supporting a loved one through a chronic illness. And I also want to share other resources. We have this Shine Hope partnership. And we have signed on to be a hopeful city because we have found that hopelessness is associated with many chronic mental health conditions. When people start to feel suicidal, feel like life is not worth living, when people become violent, when people become self-destructive, when you peel the layers, you find out at the bottom of all of that is just a sense of hopelessness, like I have no control. So we have this SHINE framework, which is to help develop hope. And that hope is teachable. It can be taught, and hope is protective. And sometimes hope comes from hearing other people's stories, from being able to document what gives you hope, what makes you feel better. And so caregivers, those who are going through severe mental illnesses, we also want to encourage them to check out this Shine Hope framework on our website. There are resources. It can even be taught to children to build up their hope. Hope is a defense, is a protector against, severe mental illnesses and many other expressions of, severe mental illness. So we want folks to know that that is available and readily accessible for our audience.
That's great. You spoke about support and resources, and we're lucky here in the great city of Chicago to have the Chicago Department of Public Health. What are some sources of information, some places that folks can seek out education and other resources that the city and the Department of Public Health provides?
Yes. We like to provide wraparound support across the spectrum. Those who are experiencing stress and need additional support. So we have programs like the Healing Arts program, yoga, sound therapy, dance workshops that just help people, stay healthy physically and mentally. Their puzzles, their art games, etc. And then we have programs, we have therapy group and individual therapy at our clinics for those who just need that one-on-one or group sessions to further process what they're going through. So we have 7 clinics across the city where people can, in person, engage with a therapist or through telemedicine, be able to talk to someone if that's what they prefer. We have those with severe mental illnesses that have long-term medication and need someone to help them with the medication management. We also offer those services at our clinics. And then we have programs for those who might be in crisis So there is NAMI Chicago that provides also online and in-person support to those who may be having suicidal ideation. If you're out there and you're thinking about it's not worth going on, I feel like killing myself, that is an emergency. We want you to be able to call 988 immediately. Please do not ignore that voice. If there is a voice in your head saying, end it all, please call someone now. There are resources available and there is support available. We also at the Chicago Department of Public Health provide crisis response services, mobile services. So if you call 911 and request for the CARE team, that's CARE, that's the Crisis Assistance Response and Engagement team, they will be able to come out in person and provide some support for those who are in crisis. So we have all of these services. And the last thing that I will share with you, the Chicago Department of Health also support mental health service delivery across the city, wherever you are getting your primary care right now. We have partners with more than 30 different providers across the city to expand the mental health services so that you can get your mental health services where you are already getting your primary care. In fact, we have some partnerships at food pantries. You know, if you're going through a food crisis or you're food insecure and you go to a food pantry and you get help, we have locations where there will be a therapist there who can help you talk through, you know, how to navigate life when things are challenging. So there is no wrong door. We want folks to know that whatever is comfortable for you, online, in person, in the clinic, in other places, we want people to be able to access the mental health services that they need and the support that they need.
So the city has all of these amazing services and resources available to folks. What can folks expect about these services? What can they expect to pay? And where can you maybe learn about this more online?
Yes, I know that cost is always a consideration for a lot of people, and I'm very glad to say that we provide services regardless of ability to pay. So for those who have insurance, yes, the insurance can be billed. If you do not have insurance, it is not a barrier. So for the services we offer across the city, having insurance is not a requirement. So online services, the NAMI Chicago 988 services, behavioral health crisis response services, does not require payment. So we don't want that to be a limitation. If you need help, please call 311, call 988. Go to our website, we will come to you and make sure that you get connected to the services that you need.
Great. As a woman and a newer Chicagoan, how are you focusing on your own mental health and wellness? What local resources do you take advantage of in particular to support that for yourself?
Thank you, Jonathan. That's a good question. I am indeed a woman. I am a wife. I am a mother to two wonderful young men. And I also lead a governmental public health agency with, you know, more than 700 staff, 22 locations. So there is always a lot going on. So I am very intentional about taking care of my mental health, taking care of my body, and taking care of my mental health. So some of the things that I like to do is journaling and just processing my feelings. Sometimes the thoughts are just running around in my head, and to quieten down my mind so that I can have a restful night, I have a process of journaling every night before I go to bed. So I put the thoughts down so that I can have a restful sleep. I am also very intentional about what I eat because food is just so important to our physical and mental health. If you don't feel good physically, then you start to, you know, feel the effect in your mind as well. So making sure that I'm incorporating fruit and vegetables into my diet. And I like to unwind with comedy. I like stand-up comedy. I like, you know, sitcoms, anything that will make me laugh. is how I also unwind, and making sure that I am outdoors as much as I can, taking a walk in the evening. The lakefront is so beautiful here and relaxing. So those are some of the things that you really am intentional in incorporating into my life. And again, like for many parents, I have family and I have children that also have mental health issues, and have required support and therapy. So I also leave that as a mother, having a son who had anxiety disorder and depression. And so I understand what it means to be a caregiver to those who have mental illness and to have to navigate the complexity of our healthcare system. So also just wanting people to know that therapy is care. Therapy is not weakness. If you need help, it is okay to say, I am not coping and I need support. So that's from my own lived experience, and these were all the things that my therapist told me. Get outdoors, get off from behind your desk, have interaction with people, and do the things that make you happy.
What are some opportunities for Chicagoans to learn more about what they can do to help both themselves and the people that they care about?
Thank you, Jonathan. I think it's important for us to understand when things are going south, when you are not feeling so good, to not ignore the signs. I talked a little bit about hope. Some of the signs of hopelessness is frustration and anger and, feeling sad all the time. If these feelings persist 2 weeks, 3 weeks, if you're beginning to see a difference in your mood and in your appetite, and you don't want to do things that you enjoy doing, you don't want to go to work, you don't want to go to school, you don't just feel like doing any of the things that you will normally do, you don't want to talk to people, that is time to ask for help. So we want people to know when it is time to ask for help. Number 2 is, and when you see your loved ones struggling this way, especially when you have young ones at home, teenagers, they can be temperamental, they can be moody. When is it time to ask for help? It is when they stop doing things, and that is consistent for a while. That is always time to talk to someone. And we also provide trainings for people. You don't have to be a therapist to be able to help someone. We have a question, persuade, and refer training for people who want to be able to talk to those with severe mental illness who are considering suicide. So we provide these trainings for community residents all over the city. So if you want to learn more about how I can support those who are going through depression with the question, persuade, and refer training, you can sign up for some of our trainings and be able to support. And the last thing you can do is, know where to go, know who to call, and know when it is time to ask for help. So knowing when it is time to ask for help, knowing where to go. There are many opportunities across the city for resources and support, and knowing who to call if you are in crisis. Friends, family, faith leaders, or any of the numbers that we have shared with you. If you need help, please call someone.
You spoke a little bit about lived experiences, and as a member of the LGBTQ community myself, I know how important that is sometimes in the mental health and wellness conversation. What would you say to folks who may think that their lived experience might be part of that mental health conversation, that it might be a barrier to seeking out help?
Yes, we want, again, to acknowledge that we live in a country where there is stigma, there is discrimination, and that often people don't feel welcome in spaces, and that is a barrier to them seeking help because of the experiences that they have had. And part of the education we're doing right now is to help people understand that mental illness is something that anyone can experience, and that people We want people to feel empowered to seek support and services. We have been very intentional in creating inclusive spaces for anyone to feel welcome. And there are some of our providers who have specialty in different areas, including supporting those who are LGBTQ+, because there are unique experiences there that they wrestle with. So having people with those lived experience who can relate with our clients is also some of the services that we provide. And even for some of our crisis line, if you feel comfortable sharing and saying, this is my identity, these are some of the struggles that I'm facing, there can be providers who have shared experiences or expertise in that area who can provide support. Because it's important when you have a provider to feel like they can relate with your experience and understand what you're going through. But we do want folks to know that seeking help is important, and if you have a provider that is just not, you're just not connecting with the person and you don't feel like the person really appreciates what you are experiencing, we want you to feel like there are other options out there. We don't want that to stop you from seeking help. We just want you to be able to say, well, maybe this is not working for me, maybe I should try someone else. That is an option. So there are providers out there who have experience, who are empathetic, and who have the lived experience to be able to support people across many different demographics.
So May is Mental Health Awareness Month, and I love the approach that CDPH takes, this holistic view of mental health and wellness. What are some top tips that you would give to folks regarding things like diet and exercise and other things that contribute to positive mental wellness?
Thank you, Jonathan. Top tips: food, good food, less processed, better. More processed, not as good. Exercise, at least 30 minutes of some physical activity does wonders for your mental health. Number 3, know who to call if you're not feeling like yourself, and know where to go, and know when it is time to ask for support. One of the other tips that I want to share during this Mental Health Awareness Month is share your story. We find that hope is also developed by listening to other people's story. I shared my story so that we can all feel comfortable we're sharing our stories. Mental health issues often stigmatized. People feel like maybe I'm different, maybe I'm the only one feeling this way. There are many people who may be feeling the same way you are. So we have resources for unspoken, especially young people who feel, I don't want to worry my parents, I don't want them to worry about me, I don't want to say this is what I'm feeling. But we have platforms and spaces where you can hear from other people who have gone through what you're going through. And we want those many more people to speak out about their experiences as a way to encourage others to seek support and seek help. So that is our call this month, to create awareness, to normalize asking for help and support, and to know that there are many people out there who are feeling the same way and who have resources and engaged with services so they can feel better.
You've mentioned a lot of great resources and places that folks can go to find mental health resources. What is like a specific number that folks can call, a specific website, that folks in their communities can seek out for support?
Thank you. The number is 211. If you call 211, you will get connected to wherever you need to go. Our clinics, other clinics in your neighborhood, other services. 211 is the easiest pathway to get to the services that you need. You can also check our website, chicago.gov/health, to see what resources are available. And I talked a little bit about hope and the Shine Hope Company because we are a hopeful city. So if you want to explore the resources there for how can I develop hope, you can check the shinehopecompany.com. There are many, many resources there that are helpful, even for children, to help develop hope.
So you spoke a little bit about severe mental illness and what some of the signs that we can all look for in ourselves that we might be feeling and we might be experiencing. What are some signs that folks who are caregivers, family members, friends might look for in others that might signal severe mental illness?
Yeah, I'll talk about the three most common that leads to a lot of hospitalization. Major depression. When you see people who are very, very sad, unable to enjoy the things that they have typically enjoyed, especially when they no longer want to interact with people, they don't want to go to work, they don't want to eat, they are not able to sleep or they're sleeping too much. That is time to encourage them. Have you talked to someone? That's sort of how depression can manifest. Then we have bipolar disorder, which is a swing between depression and then mania, when people are unusually exuberant and doing really dangerous things or getting into fight or being aggressive or violent in ways that are really concerning. That is also a sign to really they are not sleeping at all. They are, just very, very animated, etc. You also, as a friend or a caregiver, do you want to talk to someone about, some of the mood changes that we're seeing? And then we have psychosis, example, schizophrenia, where people are having challenges with reality. People are hearing voices or seeing things that are not there. They're not able to tell the difference between, reality and what's not real. Or again, when these things are evident and people are seeing things that nobody else can see or hearing things that nobody else can hear. Again, it's an opportunity for us to, suggest if they want to speak to someone. Many of these conditions need professional support to help people manage. But the good news is that many people are living with severe mental illnesses and are doing well. With their medication and support, they can continue to do the things that they love and go to work and go to school and manage life. So this is why we want people to know that help is available, and so they can get people connected to help and services they need to be able to, get back to themselves and be productive members of their family.
Well, thank you so much for this really important conversation. I know how important this is, to myself personally, to my team, and to Chicagoans around the city. I particularly appreciate your vulnerability in telling your own story as part of this conversation. Is there anything else you want to say to folks to kind of close out this conversation, or maybe give a tip as we lead into Mental Health Awareness Month?
Yes, I want you to know that whatever you're feeling is valid, and there is help available to help you feel better. There is help available to help you feel better.
Thank you.
And that's our show. Thanks for joining us today. Don't forget to rate and subscribe wherever you find podcasts. I'm Dr. Bora, and we'll see you next time.